the most special of guests is Dr. Jeff Spiegel from Boston. He is one of the fellowship directors and somebody we all look up to. And fortunately, we've crossed paths before from lecturing at the same meetings nationwide, whether it's in Vegas or even out of the nation. In Brazil, we had a chance to lecture about lips and mouths with the Orofacial Club over there. And today, he's going to give us his expertise in everything he does and help clarify what goes into facial feminization surgery and lip lifting. All right. And the great thing about Dr. Spiegel, he's very, you can tell anytime you talk to him or he lectures, super intelligent, very fun, not boring to listen to. So
it depends who you ask.
Yeah. So right now you're located in Boston, right? Your place is called the Spiegel Center?
That's right. Spiegel Center in just outside of Boston, a little town called Newton. It's a suburb.
Awesome. And I know you work with your wife, but can you explain to everybody how the work goes, or the camaraderie between you two, how you treat patients?
Oh, sure. Absolutely. I mean, in some ways I work with my wife, in some ways I work for my wife, but the division of tasks at our office is that she does everything, injectables, botulinums, fillers, a lot of skincare treatments, laser, aesthetic services. And I tend to do anything which is more surgical.
Awesome. And the cool thing I think about that is that you guys both can work together to give the patients the non-surgical, the surgical, everything all together. It's not just one-sided. And especially if you're doing facial feminization, I feel like a lot of the things that you can offer somebody are going to be permanent and surgical, but certainly there's a lot of advantages to doing Botox and fillers and skin tightening and that kind of stuff on the non-surgical side as well.
Oh, sure. As you know very well, I think surgery is akin to building a house, and all of these other things are like maintaining it. So I learned the hard way. The first home I ever owned, it was a beautiful brand new back porch. And what do I know about maintaining a house? And after 2 seasons, out here in Boston, we get winters, and after 2 seasons, it collapsed. And I didn't know that I needed to have it like re-stained, painted every year or every other year.
Yeah.
And some of the wood rotted away. So it was beautiful. I had to redo it. So I think surgery is building it, and then all of these other products are keeping it looking good.
Yeah, for sure. So getting into the facial feminization, there are not many specialists in the country who really focus on that. And I think it's really nice. Your work's incredible, and it's actually like definitely has always been even from fellowship. When I was looking for fellowships, it was one of my favorites. It's something that I would be scared to get into just because I feel like emotionally on a doctor, it might take a bit of a toll, but I think, or getting into it, but I think for you, you're a very calm, understanding, nice person, and you're able to help guide people through very difficult changes in their lives and surgery like this. Are there steps that you take going through facial feminization where you guide the patients through either therapy beforehand, or make sure they're in the right mindset beforehand, or to make sure hormonally they're stable beforehand, or anything like that to prepare them for surgery?
Oh, sure. I think it's a lot like all aspects of plastic surgery, and facial plastic surgery in particular. You know very well that when you see a patient, you can tell pretty much within a couple of minutes, almost always, and we've all been burned, but you can tell almost always within a couple of minutes if this person has really sound and rational reasons for doing what they want to do. Sometimes they're going to, seem ill-prepared, or seem very nervous, or seem like they're doing it for the wrong reasons, and then you use your good judgment and tell them, maybe this is not the right moment. It's pretty unusual for someone to come for facial feminization surgery who hasn't really given it a lot of thought and done extensive research. Speaking to potential patients who want facial feminization surgery is a lot like speaking with colleagues, in that their questions are less often things like, what can you do for me? And more often very technical questions like, what incision do you use? What type of stitches do you use? Where do screws go, etc. really complicated, detailed things.
Mm-hmm.
So it tends to be a very educated and very well-researched crowd. And as I know you're aware, facial feminization is, for transgender women is a very powerful thing, but it's a very powerful thing for all women. And like the lip lifts, which I know you are very fond of and do a lot of,
Mm-hmm.
they're a feminizing procedure. You're
Yeah.
making the person appear more feminine and youthful and feminine and attractive. These are all very synonymous concepts.
Nice. And do you have somebody that you work with that does the hormonal stuff as well?
I do and I don't. There's nobody in my office who does that because the office is myself, Dr. O'Neill, my wife, and our fellow. But people come from all over the world. So typically they've seen their own PCP or a clinic in their own town, country, city, wherever they happen to be from, who does all that. And then I'll work with that doctor to help people be safe perioperatively around surgery. But I don't typically get involved in anything with hormone management other than making recommendations for what's safe around surgery and occasionally helping people with hair loss things.
Okay. And do you do mainly feminization, or do you ever do masculinization stuff for somebody who's going in the other direction?
It's a great question. Masculinization, as it turns out, is much less frequently necessary because it's harder to look feminine than masculine. So, the old joke that it takes a woman an hour to get ready to go out and the man's ready in 5 minutes or less. And, it's a joke, but it's true. And the reason it's true is it's hard for a woman to look feminine and attractive, even an attractive woman. And for someone who looks very masculine to look feminine, it takes a lot of work, but it's pretty easy for anyone to look masculine. So if you want to look masculine, you take testosterone or androgenizing hormones, and you're going to look more masculine, right? A lot of female bodybuilders who take male hormones start to get very masculine facial structures, deeper voices, prominent brows, thicker jaws, and it's not just the muscles. If you take testosterone shots, I can assure you, your hair is going to fall out. You're going to grow a beard. You're going to get a pot belly. You're going to look like a guy in no time.
Yeah.
So we do it sometimes. That was a long answer, but the answer is surgery occasionally for people who have very fair features, want a stronger jaw, a wider chin. Very rarely someone will want an Adam's apple put in, but that's not so important because the presence of an Adam's apple on a woman is unusual, but the absence on a man is not. You don't have much of a visible Adam's apple, nor do I, and that doesn't really mean much.
And so I was going to ask you about that. I know a lot of doctors who practice facial feminization when they're, I'd say, getting into it. They don't really do all aspects of it. From what I've seen, you do the surgeries where we're reducing the thyroid cartilage prominence. How often do you do that, and how does the surgery actually work?
So for Adam's apple surgery, to add an Adam's apple is pretty unusual for us. To remove one is something that, when we're allowed to operate, right, is 4 or 5 times a week. And what we're doing there is a couple ways to do it. The main way that I do it is with an incision about the width of your thumbnail, a little smaller, way up here on the bottom of your chin neck area where you can't really see the incision. Then we'll go in, look directly at the cartilage, and we use, as you know very well, this floating keyhole concept where you can make an incision here, but you can slide the hole down to where you want it. So you can do your surgery down here while your incision's up there. Take off the maximum. The key to it, really, which we wrote about and published a long time ago, already, at least a dozen years ago, is that you have to have a video camera, a fiber optic scope to look at where the vocal cords are. Otherwise, it's very easy to cause the person voice harm. And we've never done that. And there are a couple ways to fix it, but you don't want to be fixing problems. You'd rather have none to start with.
Right. And do you ever go as far as actually changing vocal cord positioning by moving the attachments of the vocal cords forward or backwards, like we do in restorative voice surgery, or is that going too far?
No, we do that. It's a great thing. So actually, we don't tend to do it through the same incision, although I've considered it, but we do a lot of vocal feminization. And it's interesting to hear on our website, there's some samples of it. But we do that through the mouth, and you go down, look at the vocal cords, and we're shortening them, just like you said, by creating a web about 35% back. And we've done some research on this, and in our basic science research on this, it's clear that that's the spot that gives people the peak vocal cord elevation, but it's a little unpredictable how much they'll get. It seems to be that younger people get a better result than people who get into their 60s and 70s, but everyone should get a pretty nice improvement.
Right. And these surgeries, I know initially the main ones that we had learned about back in residency were performed by a plastic surgeon. But I think nowadays to do vocal cord changes, it's mostly ENT trained, laryngology trained doctors, right?
Yeah, I think there's been a trend in plastic surgery in general where facial plastic surgery, which tend to be otolaryngology trained people, are tending to do the majority of facial plastic surgery in the country. There are some very excellent rhinoplasty surgeons and facelift surgeons who come from the general plastic surgery world, but more and more I think that they're finding the younger people are finding their training there tends to be so specialized in breast and body surgery that facial surgery tends to come from the facial plastic side.
All right. And so, I wanted to look at some examples of your work to see what's done. Looking from, I was looking at a bunch of your photos, and from top to bottom, I see there's so many changes that are made in the eyes, around the lips. And I just want to see, like, when you see a patient like this who says, I want to go through feminization, what are you seeing on their face that I'm missing? Because sometimes I don't see it, what would feminize them.
Okay, so how we would look at a person like this is we kind of go top to bottom. I mean, it's important to ask the person what they want, of course, but I tend to get a lot of people who say, just do what we can do to make me look my best. So hairline position is part of it. You want to bring the hairline to a certain shape is even more important than the position. Men, of course, tend to get temporal recession. I'm an unfortunately all too good example of this. And otherwise, the hairline tends to be more rounded on a woman. So we will create that either by bringing the hairline forward or with hair grafts or a combination. Men tend to have a very prominent brow ridge here, which creates a horizontal shadow of light that we can see in photographs and when you interact with somebody. And that creates a lot of shadowing of the eyes. Right. When the eyes are, if you look at this picture, actually the one you put up is a good example of that. We filled in the cheeks. The cheeks are like reflectors. These are going to bounce light up into the eyes. And this part here is a ridge that's like a visor that's shadowing the eyes. Horizontal eyebrows plus darker eyes equals a more masculine, less attractive look. So by getting the eyebrows up with a brow lift, getting all this bone back, we make the eyes larger, more forward, brighter, and then we add in filler in the cheeks. As people are learning more and more, cheek filler is not really here, it's more here in the front, because you want to create that smooth line from the lower eyelids forward. So we get a lot of brightness there. A female nose, there's books and books and books on this. And I know you have read a lot of these and talk about this stuff a lot. But I find that rhinoplasty for an attractive woman's nose, you can summarize it in one word, which is forgettable. A woman's nose should be forgettable. You meet an attractive woman and I say to you, after she walks away, I say, so what did you think, Dr. Talei? What did you think of her nose? Even though you're a nose doctor, if she's a really good looking woman, you're going to say, I didn't notice she had a nose. Did she have a nose? I didn't see it. Right?
Look at the eyes and the mouth. Yeah.
Right. You got the eyes, the mouth, every other thing, personality, who knows what else. But you shouldn't have seen anything on the nose. And if you can say, oh, yeah, she had that bump and she was down, that's where the problem is. So we try to make noses forgettable. Lip lifts, of course, you are super active in that. And we talked a little bit about it, but you want to see the teeth. Seeing your teeth is what creates the brightness. And then there's all the other details, right? The devil's in the details, the curves, the projection, all those things, but you got to get the brightness. I know you talk about that and write about that. And then the jaw shape. A lot of surgery in Asia or Korea, China, they talk about this K-pop surgery, which is getting a V-line to the chin, getting your face to look a certain way. And so we do a ton of that. And those same procedures are very important for feminizing a face.
Angloplasties and stuff. So looking at these faces, I mean, the cool thing about a lot of your photos is that the changes are not so dramatic that their family and friends don't recognize them. I feel like they maintain a lot of their character still.
Yeah, we try to.
Yeah, and so
every now and then someone says, I want to look like a different person, like I was never, related to my family. But most of the time, it's people want to look like their own sister or, cousin, someone in their family who's an attractive woman that they'd like to look like. When I get people who want to look like someone different, you may see this too, but I get people who are like professional gamblers who don't want to be picked up by the cameras anymore. Really? And they want to change very fundamental features of their face so they look like someone totally different. And the eye in the sky.
It's like a Nip Tuck episode.
Yeah, no, but we see that all the time. And that's kind of a funny thing. Every now and then someone will write me a little list of how to play blackjack correctly.
Oh, wow. So that's awesome. So this patient, I think it's a very impressive result. And I see so many small changes. What did you do to get her from left to right over there?
Yeah. Well, looking at that, I think she's kind of a well-known person now. But if you look at her forehead, again, you can kind of see how the eyes shape and angulation look kind of different. Mm-hmm. The nose is different. The lip is brighter. It doesn't look like she's trying so hard. Everything is really softer. And that's a lot of it, kind of taking the edge off. Yeah. And I think what we talked about earlier about, bodybuilders and people who might have looked like the after face, take hormones, and they start to look like the before face here. Right. Everything gets kind of harder, and we're kind of softening things, taking it away.
And the cool thing about this photo is that you kind of see that it's not just gender transforming. You could have somebody who is a woman with masculine features and they go to a facial feminization specialist and they can get improvements themselves, being a woman already, just having strong features and softening them.
That's right. So you're absolutely right. Sorry, go ahead.
Yeah, I mean, I think this is a good example of somebody who 100% could be female with a little bit of masculine character, and then you transform it to somebody just softer and more beautiful.
Yeah, that's right. And what will happen is we'll see people at my office in Boston who have been to the plastic surgeons in their town, and they go in, like the person on the before picture here, and they say, I don't feel like I look that great. And the person runs through what they do, and they say, okay, I do facelift, I can do laser, Botox, blepharoplasty, and they run through sort of a list of standard things. And if they don't know about lip lifts and they don't do cranioplasty and they don't do V-line surgery, things like this, then they're going to run out of options there.
Right. And you never get the patient to their potential.
Yeah.
Yeah, and it's not just their potential, it's their natural potential, because sometimes you try to push the envelope with not knowing enough procedures where, if you have more exposure to facial feminization world, little tiny things that you could do to get somebody there. So
different things.
Yeah. And this patient, I think also, these are like really nice, subtle changes where if her family saw her, hadn't seen her in like 3 months, 4 months, 5 months, they're not going to freak out. They're going to say, okay, well, it's the same person I've known forever.
Yeah, that's right. In fact, what happens is the person, like this is a transgender face before and after, and the person before sees all their friends and family, and they understand that the person sees themselves as a woman, but they might make slip-ups in using the right pronouns or being respectful in how they address the person, even subconsciously, because we recognize a person's gender, familiarity, attractiveness, all these features about them in a fraction of a second. Right. So someone might look at that person and use the wrong gender pronouns, whereas afterwards it fits who they say they are and who you see match up. So you still see, Trish, but now Trish looks like Trish, and you don't make an accident in using the wrong words, and everybody has this sort of peace.
Yeah, and it must be such a, I'd say, transformative experience for them. I mean, it is transformative, but such a big stepping stone once they get to that point, because the patients that I've seen have been tormented so many years, not identifying with who they are and who they look like, that once you get to that final step of doing something like this that you see in the photo, it really takes them to that point where they need to be comfortable.
That's right. It's very, very disquieting and disconcerting, I think, to know who you are, but to have other people not see you for who you are. And so this creates a synergy there. And again, this is sort of specific to the problem of gender, but it's the same thing for all plastic surgery, right? So someone who comes to you who says, I'm a young, vibrant woman, and they look in the mirror and they see someone else. They get a facelift or a lip lift, or a facelift and a lip lift, or a facelift, lip lift, and some skin conditioning. And all of a sudden, who they are and who they project match up. And there's that great piece that comes with that.
Yeah, and I've had patients ask me before, what about reversing surgery? And I say, well, this kind of surgery, when somebody goes through it, uniformly, they're happy with it. Do you tell patients something like, not that there's no turning back, but the changes we're going to make, they're going to be you, they're going to be natural. Do patients ever actually say, I am upset about losing my character? Does that ever happen with this?
It hasn't, but I have two ready responses to it. One is that it turns out that the way our brains process beauty, that a feminine-looking female is much more attractive than a masculine-looking female, but a little more feminine-looking man tends to be seen as more attractive than a very masculine-looking man as well. So if it ever came to be that someone had one of these procedures done, if they stopped doing the other things and dressed as a man, spoke as a man, projected themselves as a man, for the most part, they would just look like a more attractive man. That being said, pretty much everything's reversible in one way or another, right? Like if I take a bump off your nose, we can put a bump back, just make it out of rib cartilage or something else. And if we take a piece of your jawbone away, you can add it back. We don't have to do that ever, but it could be done if that ever was to come up.
Now, as a generalization of thicker skin types, which could be African American, it could be sebaceous skin, acne forming skin, just thicker skin types in general, are these harder to feminize as a group, as a cohort? Are they harder to make more delicate, or do you just have a different set of rules for them on how you go about doing things?
I think both, right? So, you do a lot of rhinoplasty, and you know that it's a little bit like if somebody has six-pack abs, they're going to show better through a Lycra t-shirt than a down jacket.
Right.
So
I don't have this problem.
I do. I just don't want to show you. So if you have really nice, you can make really nice structure to a person's nose, and then if you're going to lay on top of it this thick piece of skin, all your beautiful work is kind of camouflaged, and you need to probably need to accentuate or exaggerate some of the features so that the contours show through. And so we'll do that to an extent. And I think with experience comes knowledge of how much the skin will contract, how it's going to change with age. So we'll tell somebody with very thick skin, you might find that it's not what you want for several months, but it'll get there. And I'd rather have it be what you want 4 months from now and last for years and years than to have it be what you want immediately and last for 4 months.
Now, yeah, that's awesome. So the other thing I see in a lot of the photos is their skin looks a lot better, and it could be from some of them I've seen from lifts or maybe makeup, maybe things like that. But one of the things that is a subtle indicator of masculine versus feminine I've seen, even with testosterone, when patients start taking testosterone pills, their skin gets a little more oily, sebaceous, more porous. And when they're more feminine, delicate patients have just nicer skin overall. Do you put patients on skincare regimens or send them to somebody to do skincare as part of this?
We do. So when, 15, 18 years ago, could be more already, all women postmenopausal were taking hormone supplements. And then it was decided that maybe wasn't such a good idea, and a lot of people stopped doing that. And the biggest loss that people experienced from this was the changes in their skin quality and skin tone. So if somebody is taking estrogens, that's going to help to a degree. But then we also put them on a very specific skincare regimen, and we hope that people will follow it, right? So you use a combination of IPL, intense pulse light, annually or more frequently. That's been studied and has good response. We like radio frequency microneedling to build the skin. And then we have a couple of lines of skincare that we recommend.
Yeah, so I think a lot of that contributes to overall skin health and looking good, but also women in general or more feminized skin types do look better. Guys, you could look at somebody with like rough skin and you're like, okay, masculine's masculine, but for women to be feminine, they do have to, try to at least have nicer skin. So this one I'm looking at is a very subtle change, but it was enough to become more feminine. So what did you do here?
Yeah. If you look at the medial or more central part of the eyebrow, that's been repositioned. The whole eyebrow is up a little bit, but in the before photos, the central half of the eyebrow is almost concave. If you looked at it from down to up, from up down, up looking down, it's almost concave, and afterwards it's not. We've refined the nose, filled in the cheeks and the lower eyelid area. So one of the things that's a little limiting, and when you look at some of these photos, is that not everybody does everything I ask them to do, or rather, don't ask them to do. Not everybody does everything that I think would be ideal for them. Is a better way to think about it. What's interesting, though, is what you said is it's not clear on initial glance what's different, but the face on the right, if you see it in a different context than this discussion, you wouldn't wonder, is that a man or a woman? And the face on the left, similarly, you wouldn't wonder if it's a man or a woman. Right. You have the answer immediately. And that's kind of the really interesting part of facial feminization, I think, is as a way of analyzing faces.
Yeah, and I see on a lot of these, you are doing the nose, the eyes, the lip, but to very subtle extents. Her chin looks narrower to me.
Yeah, definitely made narrower.
You did that. Okay. Yeah. So that I think made a huge difference on her, and she looks untouched in the after. Like if I were to see her, I would not think she's ever had an operation to get her there. She looks untouched.
Well, thank you. That's the key, of course. We have to be like ninjas. Leave no trace.
Yeah. So, going through these photos, I see a lot of different ones. This photo, she looks younger as well, and the nose looks a little narrower, slimmer. The chin looks. Yeah. I think that there was a major jawline change here. So what did you do on this patient to get her there?
Yeah. So jawline surgery is very powerful and very judgment based, meaning that you need to think very carefully about how much you can remove, because for the most part, we're not going to take away a lot of the exterior covering. You got to think about how much is this going to shrink down, because if I take away, it's like losing weight. If you lose weight, your clothes will fit nicer. If you lose a lot of weight, you need new clothes, but you're not getting new clothes on your face here, although you can tighten it to some degree with a facelift. What we'll do is we'll take away bone from the sides, take away bone from the bottom, and we'll try to make it so it's going to be something that will still fit and the skin will still fit. And then we can shrink the skin down onto it. And I do a little bit, I've never talked about this before, but I do a little bit, maybe one time, what I call an internal facelift, where when we've accessed the mandible, the jawbone, when you put it back together, you don't have to sew it right back where it was. You can sew it a bit back and kind of bring the face back from inside.
Ah, cool.
You don't have to line it up just the same way. So I can, in the jawline area, kind of walk it back and create a tighter jawline from inside the mouth.
Oh, wow. So would that work? This is for my own curiosity too. I've had a lot of patients with just a little bit of chin or labial gingival kind of laxity. And I've tried a couple times and I've gotten minor changes, but only in the front. Have you ever done it for that reason, to kind of tighten everything back?
Yeah, that's a good place to do it. And it's tough. The other thing you can do there is a chin implant or a genioplasty that's a little bit high to kind of prop it up. And then, but especially if someone has like a droopy chin with tooth show, very challenging thing. And sometimes you have to even do circumdental, a little shop talk now for the observers, for the watchers. But you have to do like circumdental stitches deep into the muscles here to kind of really pull it up while it's healing, and have the person wear a dressing for a couple weeks so that it holds in place as it's healing, because that can be very challenging to get right.
Yeah. Awesome. Yeah. I'm going
Gives me nightmares at times, but we get it, but it's hard work.
So I see a lot of changes here in so many of these patients. And I think even when I had seen on facial feminization websites, the forums that the patients are on as they're going through it, one of the major things is doing lip lifts. And you, for much longer than me, you've been really one of like the world experts in lip lifts, and you've got amazing results. And what I love is that you're the prime example of when I try to tell people, I say, we do things differently, but we agree on everything.
Yeah.
You know, it's there's so many ways to do it, so many logical ways. And the way you do it, you know, I love. And I see that some patients get just nicer, poutier lips, more tooth show. Some patients get more feminized. Do you have, I mean, it seems like in my own practice, I can control that where I do it on a guy, it doesn't feminize them. Do you have any things that you do during a lip lift where it's not just making it look better, but it's actually becoming more feminine?
I do, and I'm not sure I have a ready to go answer on what it is, because a lot of it's just sort of looking at it and seeing what you have to do, right?
Right.
So I've never really tried to think about that exactly, but as you know, the placement of stitches underneath the skin can be very powerful in controlling the shape you're going to get.
Mm-hmm.
I think that one of the things that I try to do, oh, here's a very cute girl. One of the things, very cute girl. One of the things I try to do is medialize, bring the lips in as I close it together when we're doing it for feminization, because that's going to accentuate the filtral lines. So instead of just up, we kind of go up and in, which does a couple of things. One, it accentuates the filtral lines, and two, is it gets a little more pull at the sides, which, as you know, can be the hardest part in a lip lift, is getting it out at the corners. And that tends to be the spot that once in a while you need to go back and do like a direct corner lift or something to really fine tune that spot.
Yeah, I find the same thing. So, you know, I think a message for patients is to know that when you're with an expert for lip lifts, you can control what you're doing. And that includes doing it on a man, not feminizing them, doing it on a woman, feminizing them, or doing it on a man and feminizing them when they're going through.
That's right. And it's all in the shape of the incision too. Yeah, I've heard you talk on this many times, and you know, as you go out further to the sides, you can change things differently on a man versus a woman. Versus some people do this very central. I don't tend to do it exclusively in the center, because you tend to get a little bit of a rabbity look if you do that. Yeah. So we tend to go very far lateral.
I agree.
And you can control the whole thing.
Yeah, I agree. And that's important for patients to know about central or centrally preferential, like lip lifts. The problems I've seen with them, you get too rabbity. It's not a natural lift because you change the ratios of the lip dramatically, not, you know, by 0.5 millimeter. It's pretty dramatic. You didn't lift the side at all. And they don't age as well. Because you lifted this, you made it younger, the side of the mouth you left old, and everybody complains. Yeah, they all complain about RBF. So you're really doing a disservice. On top of that, they seem to scar more because you don't release all that tension.
That's right. And you have, it can affect your nose and all kinds of things.
Yeah. So we stay away from central. But you see on these photos, they just become so much fresher and nicer and more accented. And it seems, you know, like these are actually, how far after? I think yours heal faster than mine do. How far after are these photos?
Well, I don't know if that's the case. If that's the case, it's got to be like Boston water or something lucky. The photos are all different time periods. Some of them are, you know, months later. Some are years later. Some are probably as soon as 4 weeks. It depends.
Yeah, these are nice. And this is sort of what you're talking about there, where they have more accent along the filtral columns, a little bit more shape to it as well. And now she's got that kind of whistle lip where you can actually see that the lips aren't hanging on each other. She has a little more tooth show, even though she's not opening her mouth.
Yeah. That's right. And filling in the filtrums is something that an expert lip injector does, right? If you're going to get your lips augmented, if you go to a really good person, they're going to put a tiny little bit in the filtrum to accentuate that, to get a really attractive mouth. Yeah,
really nice Cupid's bow. And so going back to these, when you're doing cheek augmentation on somebody like this, Do you do implants, fillers, fat? What's your go-to?
Implants, fillers, and fat.
Oh,
So
good.
if somebody is local,
How do you choose? Yeah.
Well, I let them choose. It's a combination. If somebody is local, I'm a pragmatist. If you're local and you're afraid of having a foreign body, right? A silicone implant is a foreign body, and some people just don't like that concept. In that case, fillers are the way to go, or fat grafting. If we're already doing fat grafting, like if you have, if you're going to have a facelift at the same time, or if you have a lot of temporal hollowing, I think filling in that with fat's the way to go. Then I'll tell you, we already have fat. Let's just use fat everywhere, because why mix the media and cross the streams here? We'll just put some here, and other things. If you're also very, very slender, then sometimes there is no fat as an option. You need an implant plus a filler, because you can put the implant here, but around the edges of the implant, to make the person's face look softer, you need to add some filler later too. The hard part, as you're well aware, is having people understand that most of the time things are a process and a commitment. As we talked about earlier, we're going to make you look good today, but if you want to stay looking good, especially if someone's a transgender woman, a lot of them don't realize that the facial feminization surgery just gets you to the starting point, and then you get all the same maintenance that every other woman has to deal with all the time.
Right. Which is yeah. one of the downsides of becoming a woman is all the maintenance.
Yeah, it's harder to look attractive as a woman than a man. We have it easy.
Yeah. So we have some questions for you that patients are asking. So what's the recovery like when you're doing these angloplasties and jawline reductions? Because most of them are done through the mouth.
Yep, I do all of them through the mouth, and the recovery is both easy and horrible at the same time. It's easy in that there are no visible incisions. There's not a lot of work for you to do. You don't have to do any like creams or ointments or anything like that, and pretty much just have to wear a bandage. Plus, you can eat anything you want to as soon as you want to. After surgery, I don't have any dietary restrictions for people, although nobody's going to want to have a bunch of hot sauce and hard chips for a couple of days at least. But then the hard part is it takes some time. I typically will tell people it's 3 weeks until you feel like you got an improvement from where you started. And at that 3 weeks, you're going to say, I look better, and it wasn't worth it because I don't look better enough. But at 3 months, you look better enough. And at 6 months, you look better still. And at a year, you look much better. So it's probably a 3-week period of time until you feel like you got anything out of it. But you have to recognize that it's not going to be enough.
And, somebody else is asking about Lefort fractures. So if you're doing the orthognathic or craniofacial type stuff, do you do that yourself, or do you have somebody that you partner with, or what do you do for those cases?
I'll typically not get involved in the orthognathic changes because there's a lot of orthodontia involved in that, and you typically have to put people in braces and really adjust their tooth positions. And most of our patients travel in, and it's just not practical to have them coming in so regularly for those kinds of changes. So I'll usually leave that with the someone in their town and either talk to them, or they'll come back after their bite is where it belongs, and then we can fine tune the appearance.
So another question I get a lot is whether or not the lip lift is recommended for people in their 20s and 30s. And I've got my own answer.
So what do you say?
Well, I say it's not an age-dependent surgery. It used to be, or when doctors aren't good at it, it is. But if you're good at it and you can do this surgery for somebody without changing their character negatively, or making them age strangely, or scar them, or widen their nose, then you have no trade-off. And so I base it then on somebody needs a shorter lip, and so I have no problem doing it on people in their 20s and 30s if they have an elongated lip, poorly functioning lip, bad tooth show, without dentistry being the problem. So I have zero age dependence on it. I don't think 15-year-olds are asking for it, but certainly 20s and 30s, it's very common now. And I do it based on need, not on age at all.
No, I agree with you. I think that it's a tooth show issue. If you're a young woman in her 20s and you can't see your upper teeth, and your lip is not enormously full, so it's going to look weird if we did it, then it's a great procedure. I mean, you're like an ideal candidate for it because a young woman should have a young mouth and an attractive mouth and have that kind of tooth show. And if you're in your 60s or 70s, you need to do it differently because having the same tooth show as a 20-year-old is going to look out of place. But you want to look like a really great looking person who's not in her 20s, and you can make it just right.
Yeah, and I always tell patients it's not a replacement for filler. It does something different. And so we have somebody watching, Yasmin Petty, who's beautiful and is very well aware of these things, and said the same thing, that there is a role for it in allowing patients to do less filler or even making it easier to do filler. Let's say for patients who just have elongated lips and they look terrible every time you fill them. Once you do a lip lift, you're more amenable to receiving filler.
For sure. And how are you, the Real Housewives television programs, particularly the one I used to watch long ago that took place in your neighborhood there. The women had huge lips and they looked out of place because full lips are attractive for one reason, but they don't look right unless you have the tooth show. So they're full and of the right amount of brightness. Otherwise, it's not going to work. One thing I do, I don't know if you've been doing this, is if somebody wants full lips at the same time, you can take the skin that you excised from the lip lift, deepithelialize it, and put it in as a dermal graft into the lip and give them some instant volume. So
I saw you talking about that. That's cool. I've done it maybe twice that way. And the other times it's similar. I'll have to make a separate incision somewhere and either do a dermis fat graft or a SMAS graft during a facelift. I'll take SMAS.
SMAS is great for that. And we've done temporalis fascia when we're doing forehead work or brow lifts at the same time. It's a really nice one.
Yeah, I haven't done that. That's cool.
Yeah, and you can get it from behind the ear, of course. So we're all familiar with getting that, and it's one of those excess tissues available to us.
Yeah, I'm going to have to try it.
It slides nicely. It's a good one.
So if you've had jaw joint placement surgery, replacement before, does that impact the ability to shorten the chin or feminize the chin? I mean, I think that's very case
probably
dependent.
not.
Yeah,
probably not. But I, jaw joint, TMJ joint replacement up in here, I pretty much believe X-rays are not necessary for these surgeries. Somebody who's had a jaw joint replacement, I'm going to need to see an X-ray to see where your prosthetic goes, so we can make sure we don't mess it up. But it shouldn't be a problem, especially in the front.
Cool. And then a question. So this is, this is a question about lifting the skin or the muscle. There's actually more options than that. So people are aware there's releasing, there's SMAS, there's muscle, there's all that. And it's a nice question because we do it differently where I placate muscle pretty rarely. I think you do it a little more often.
Yeah, I'd say it's not that common, but I don't know how often you do it, but most of the time this procedure goes down to the muscle. You don't tend to go through it or try to adjust it too much. If somebody's quite old or has some weakness, then maybe. Yeah. But most of the time, I feel like the muscle layer is a little bit the bottom of our dissection.
Right. Yeah. So I say for most patients, you don't really need to look if a surgeon is how they do their technique. It's more important what the results are. When you see like my results and Dr. Spiegel's results, they're pretty similar. Like when you see them and you notice that amongst the better surgeons, they're getting these very natural, yet very nicely like accented results. And ultimately, there's a lot of surgeons who describe it as muscle and SMAS and skin only and this and that. It doesn't really matter as much as their results. So if they've got tons of good results, that's really all that matters.
Yeah, and both of us share what we do pretty widely, so it's not really hard to find out how to do it right. If
there's no secret.
Doesn't do this often.
Yeah, there's no secret.
Although it could be a little bit like hitting a baseball, right? It's easy to read how to do it, but it's hard to do it too.
Yeah, true. So somebody wants to know, are there long-term changes in the nose after a lip lift?
There should not be, in my opinion. I tend to structure things so that the lip is supported by deeper tissues and not from the nose. I will occasionally have people who say, I had nose surgery in the past and I don't like this or that, or could you do this or that to my nose at the same time? And there are certain things one can do at the same time to the nose to a lip lift. For example, it's not that hard to narrow the nostrils at the same time. if you want to make a little jog into the nose with your lip lift incision. Or you can adjust the angle of this part of your nose to some extent if desired. But a lot of the times people will say, I don't want you to do anything to my nose, and we won't. But it's fine to do it, and it's fine to do a rhinoplasty and nose surgery with a lip lift at the same time.
Yeah, so let's clarify a couple of these things. So first I'll say, as far as this question goes, before I get rid of it, my answer to patients is there shouldn't be a change. However, amongst the good surgeons, because otherwise you do a tension lip lift and it can spread the nose. But if you do a no tension lip lift, you go and you look at the nose afterwards, and if you look at 5 different photos, 5 different angles, 4 of them you're not going to notice a difference. 1 of them you might notice a minor character difference. And I don't know how to explain that to people. I say, like, you might notice a minor character difference, but if that little tiny character difference bothers you, don't do a lip lift. You shouldn't be doing surgery at all on the face, because these things can happen, but it doesn't change the nose to any appreciable extent. So let's clarify things for people, since I'm on the same page as you and your lovely research paper that you published about lip lifts and rhinoplasty. Can you do a rhinoplasty or a revision rhinoplasty the same time as a lip lift?
It is hard to think of a situation that you could not.
Correct. I agree 100%. And we both do a lot of rhinoplasty and a lot of lip lift. And the only people I've heard say otherwise are people who haven't done a lot.
Yeah. Now, in their defense, a lot of the books say you shouldn't do it. The older books say this is not something that can be done at the same time. And that never made any sense to me. And so then we published our results. You mentioned the paper, 100 or so in a row of doing them together, and there's no problem. And it's totally fine to do it. So it could just be old information that people haven't caught up with. But there's clearly, if it's done right, there's clearly no reason why a lip lift and a rhinoplasty can't be done at the same time. Even if you use the open technique, even if you use the closed technique, it really doesn't matter.
Yeah. And I tell people with the open technique, don't get creative with incisions of trying to combine incisions or do this and that. If you're doing classic transcolumellar incision, classic lip lift incision, you're fine. If if you try to get creative and you're on a revision rhinoplasty, then yes, you can have a problem. Don't get creative and try to lift a flap from here to here on a revision. It's can cause a problem. Or somebody who's had vascular compromise, there's obviously something wrong. So don't do them together. Simplify.
Yeah, you need to think about it, but for the most part, it's hard to find someone. You'd have to look for someone for whom you could not do it.
Yeah, I agree. And the only limitation I have when doing them together is I can't always do all my alarplasty work. Sometimes I have to finish the alarplasty work later if I wanted to just, trim something on the side without combining the incisions too much. And what about the question that I have so many patients that come in and they are asking for a lip lift and they say, well, I had a rhinoplasty and my lip got longer after the rhinoplasty, but my rhinoplasty surgeon said, no, that's impossible. And I personally, again, doing a lot of rhinoplasty and lip lifts, even if you don't change the position of the nose, you can make the lip look longer just by exposing down pointed to up pointed. But having felt so many nasal bases, I tell other doctors, no, definitively you can change the lip position and drop it with deprojection maneuvers, transfixion with nasal base dissections, extensive base dissections, and even columellar struts if they're extended down past the nasal spine. So
all true, and the other one, of course, is sometimes people had their rhinoplasty 10, 15 years ago, and their lip has lengthened.
Also, yes. Yeah, that's
everything. And your face got saggier too, and your arms are saggier. I don't think that's from your nose either.
Yeah, no, that's very often the case. And similarly, those patients come in and they say that they're seeing a crease now when they smile. And they didn't have it before.
Yeah, well, you lecture about that, and the crease on the lip is almost a green flag saying, "Come do a lip lift for me."
Yeah.
It's almost like it's time.
I agree. I agree. It shows, I think, where the lip would like to start is, it would like to start there.
It's showing you there's excess stuff here.
Yeah, exactly. So we've got more and more questions coming in. One of them is, do y'all take Blue Cross?
I don't know how it works for you. We take no insurance and all insurance. And what I mean by that is we're not really in network with any kind of insurance agency. That being said, for some procedures, like the facial feminization procedures for certain people, some of their employers or insurance companies will give them what's called an LOA, or a letter of authorization, where they say that they'll agree to sponsor the person for surgery. And then, of course, we'll work with anybody who wants to do that. A lip lift for a transgender woman is with the right employer and right insurance, sometimes can be a covered procedure. For a woman who wants this for aging face reasons or more attractive reasons, pretty much it's hard to conceive of anyone covering that.
Mm-hmm.
Especially
so that's really interesting about the facial feminization. I had heard those things, but I'm not in that world, so I never followed through. But yeah, I have had patients who said that they actually were helped out by their insurance, but they had a special type of insurance, from what I remember. That's very cool.
It's insurance is a funny world. People don't necessarily realize that a lot of times what's covered by your insurance is the insurance company works with your employer. So if you work for Google, for example, Google might say, we're going to have your health insurance administered by Aetna or United or Blue Cross or whoever. And this is what we're going to cover. And it's not really up to the insurer, it's up to the employer.
Oh, that's cool. I didn't know that. All right. Well, we're getting towards the end of the hour here. So thank you so much, Dr. Spiegel. For anybody who wants to see his work, you can visit the Spiegel Center in Massachusetts over there, or you can see on his Instagram, which is right connected over here, the Dr. Spiegel one. Oh. And I think your website is also just drspiegel.com.
Yeah, DRSPIEGEL, I before E.
Perfect. All right. Well, thank you so much. You've educated me through the years, so thank you for that. And then thank you for spending the day with us during the Corona times to educate everybody else.
Oh, it was a lot of fun. This was, I've done a bunch of these kind of online educational symposiums, and I must say this was the most entertaining of all of them. So it was, you're not only a good surgeon, but a good host as well, or MC, whatever the right word would be.
Thank you. All right. So if you guys want to see this podcast later, we'll have it on YouTube, Spotify, and then on Instagram TV as well. So we'll send that to you, Dr. Spiegel, so you can have it for your patients and followers as well.
Great. And everybody tune in for all the other Ben Talei reality pill shows, because they're all good.
We got some good ones coming. All right, everybody, take care.
All right. Thanks. Bye-bye.